Welcome to yet another interesting episode of the program Community Health. I am your regular anchor, Hasia Ali. Today in the studio we have Dr. Paul Emwanta from Department of Medicine, Ahmadu Bello University Teaching Hospital, Shika, Zaria. Dr. Emwanta is a member of Association of Resident Doctors. We say a very beautiful welcome to you, Dr. Emwanta.
Thank you very much.
You're most welcome, sir.
Thank you.
All right, listeners, today Dr. Emwanta will be talking to us about obesity. Dr. Emwanta, let's start with what is obesity?
Thank you very much. Obesity is a very important topic of discourse, and it's a global health challenge, even in this 21st century. And simply, the definition is that obesity is a condition in which a person has excess of body fat.
Okay. And
this body fat can be so much that it impairs the health of that individual. So you see that it can be a challenge, and it poses or puts the patient at an increased risk of developing some diseases, which include cardiovascular disease and even disability and death.
Wow. So
you see that it's very important. And the trend is quite alarming. It's growing. The prevalence in Nigeria, a study done showed that they will have almost like 12 million people who are obese. And also that same study showed that the age-adjusted prevalence of this condition, obesity, compared to overweight is about 11.3 for obesity and 20.3 for overweight. So you see that it's quite much. And at this point, I would like to let you know the difference. There's a difference between someone saying, okay, you're overweight or you're obese. Okay. Yes. Normally in medical practice, there are tools in which we classify and draw a distinction between these two. We use the body mass index, which is just a crude way of using the weight in kilograms of the persons over the height in meters squared of the subject. And usually we give a score of 25 to 29.9 as overweight and more than 30 for obese. So when the BMI is more than 30, we say that person is obese. And for this one, the obesity, there are also other classifications. There's class 1, class 2, and class 3. Based on the value. When it's greater than 40, we'll say somebody is morbidly obese. Wow. So at this point, the person is really at an increased risk of diseases
you mentioned earlier.
Diabetes, hypertension, even disability, and even death. So it's quite important that we know this.
Okay, you talked about using a body mass index, the BMI of 25.9 for overweight, and...
Okay, sorry, let me just make a clarification.
Okay.
It's 25 to 29.9 that is overweight. For normal weight...
Okay, 25 to 29.9.
Then for normal weight individuals, it's between 18.5 to 24.9. So for overweight, it's 25 to 29.9. Then for obese individuals greater than 30, we classify that as
So how
obese.
do you calculate the BMI?
Okay, so we use the weight of the individual in kilograms all over the height in meters square. So we do the division and we'll get the value. The height is in meters square. Yes, then we'll get the value.
All right.
But there are other ways in which we can also, apart from this BMI, we can use the waist circumference to also put the individual, because some people they store fats, their fats accumulation might be disproportionate, that you notice that in their truncal area they accumulate more fats than in any other parts of the body. So we can, or maybe their belly fats too. So we use the waist hip ratio of the waist circumference. For male is about 40, then for females about 35. So those whose readings are greater than these values, they are at increased risk of developing type 2 diabetes mellitus and also coronary artery disease. So we use that to estimate. Then for children, there's a chart, the growth chart, the percentile. So anyone that falls within a particular set percentile, we'll say this is overweight. I think the 95th percentile will say this patient is obese.
So having said so much about this obesity, let's now look at the causes. What actually causes obesity?
Okay. So the causes for obesity is there's an interplay between genetics and also environmental lifestyle factors. You see that obesity is increasing. We've seen it in studies that it's increasing in low and middle income countries, as well as being prevalent in wealthy society. For example, in Nigeria, you see that is the rich people or the more affluent people, because of their lifestyle. Now we're adopting the Western lifestyle. They are eating a lot of burgers, junk food, and the rest. You see that they accumulate more of the fat. But you see that in the Western world or the developed countries, it's now more common in the lower socioeconomic group of people. You understand? For example, in America, they say that the blacks, those that live in slums, that they are more obese than the whites that live in posh areas. So you see that there's the difference. Also, genetics has the family history, sex, and age also determine the size of the individual. Because in genetics, there can be genetic mutations which can also alter the and predispose someone to having obesity. Yes, because there's a gene, the OB gene, which is responsible for that, and is usually would produce a protein called leptin. This protein, when there's a mutation in the gene, it will lead to abnormality in this protein, which will now because this protein, it helps for to
boost an appetite.
If there's satiety, there's a particular protein that is responsible for that, and to say that you are full or you stop eating, that is satiety. There's a protein that codes a molecule that codes for it, and for hunger, there's also one that does that.
It's not the same.
So it's not the same. So you see that if there's a problem with that protein, a mutation in the gene that produces this protein leptin, you see that there's a problem. There'll be a problem with obesity. Other things that causes can be a sedentary lifestyle. You see that now the more people are now glued to their TV sets, to their handheld devices. They are not exercising. They are living a sedentary lifestyle, always glued to their TV or their laptops or their handheld device. So they're not exercising enough. They're not exercising enough.
And some are not even exercising at all.
At all, yes. So that's that. Then also midlife people that some people tend to gain weight, especially women, postmenopausal women. When they pass menopause, you see that they start adding weight. Is there too. Then some other medical conditions also can predispose persons to become obese, like when they have thyroid problems, when the thyroid hormones, when they are reduced, what we call hypothyroidism, they are predisposed to gaining weight. Then also during stressful conditions because of the hormone cortisol. Then a syndrome, this polycystic ovarian syndrome, especially which is seen in women, mostly in women of childbearing age.
Okay.
So, and this syndrome can be associated with infertility. You notice that there's this set of people that are obese. Then some drugs, steroids, anabolic steroids, oral contraceptive pills, antidepressants, insulin. They can also add to that. So, and also I've talked about the role of heredity, that obesity runs in the family, and also the genetic mutation I talked about. So basically, those are the causes of obesity.
Now that you talked about some of the causes, I was expecting you to say that there's a particular medical condition sometimes that can lead to obesity. Is there no medical condition that could lead to obesity?
Yes, I said that. I said hypothyroidism is a medical condition.
A medical condition.
Yes, can also then Cushing's syndrome. They can also then polycystic ovarian syndrome. They've been associated as medical conditions. Yes.
Okay. All right. Now let's look at the prevalence of obesity in Africa, or maybe if we can come to Nigeria.
Okay. So globally, I will start globally.
Okay.
The World Health Organization, they put in a study they did in 2020. They started with overweight. That there are about 1.9 billion people that are overweight.
Wow.
And also for obesity, about 650 million people are obese.
650 million people
worldwide.
Worldwide.
Yes, are obese. Then in one study in Nigeria, they noted that there are about 12 million people who are obese, and the age-adjusted prevalence of overweight and obesity is about 20.3 and 11.3% respectively. So that's the study that we've noted. So you see that it is of great importance, public health importance, that we do mass awareness, health advocacy on the need of us to talk more about this condition, because sometimes, because of our culture, there are many people that don't want to talk about it. They just think, I was born like that, or my parents, they've been obese. So, but of course, we need to drive this out and let everyone know about the dangers and the risk it puts to us as individuals, the health risk associated with obesity.
Okay, thank you so much, Dr. Emwanta. Now let's move to the signs and symptoms of a person who is getting obese.
Okay, so for obesity, it will be very glaring when you see somebody who is overweight or who is obese, because of course I said earlier, when you say obesity, you match it with the height. The weight of the body in relation to the height of the subject. So, of course, the symptoms, you see that glaringly the individual has a large body frame.
Okay.
Is a large body frame. Then there are other features, like they become breathless. Maybe when they are walking, they are breathless. They are easily tired. They have difficulty doing their daily activities, their chores. They are lethargic. Then also other features that you can see, they can have some body habitus, fat face, flabby arms and thighs, then protruded belly. Yes. Then for males, you see them having breast enlarged, increased because of the fat cells.
Okay.
So basically, these are the features. Then they can also present with other psychological problems. Some of them, they are insecure. They can be depressed if they have been having challenges with losing weight. They can become anxious, anxiety disorders, depression, and the rest of that.
The signs. Okay.
Yes.
As medical practitioners, are there times you just look at somebody and you just calculate in your mind and say, okay, this person is actually overweight or is obese?
Yes, looking at the person in front of you, if you see that the person is not too tall and you see that he's a bit on the heavy side, you'd infer that, of course, this person is obese or overweight. But of course, that is just subjective. So you have to do an objective assessment.
Okay.
So usually in the clinics, when they come, we will have to do the measurements, the weight and the height, and know the body mass index.
Okay.
For us to
now,
patient.
Let's look at complications that arise from obesity. Obviously, there are going to be complications.
Yes.
What are the complications?
Okay, there are several complications that can arise from one being obese. Of course, generally, as I said, they have psychological problem and psychiatric problem, anxiety, depression. Then they can have breathing problem. Sometimes they can, because of the excessive fats and weight compressing on the chest wall, the diaphragm, so they can be breathless at some points. They can have obstructive sleep apnea when they have difficulty breathing, mostly at night. Then they can have increased back strain because of the weight on their back. Then on the knees, they can have arthritis.
Okay.
They are also prone to accidents and falls because of their weight.
Okay.
They can have the osteoarthritis of the knees, the hips. Then also they can also have veins, what we call varicose veins, distension of the veins because of the pressure in which they put on the veins. Then they can also have hernia, abdominal hernia, hiatus hernia. They are also there. Then other for the ladies, menstrual irregularities, abnormalities, they can. And as I said, there's a condition, medical condition that is associated, the polycystic ovarian syndrome, whereby they have infertility, abnormal hair, body growth for females. Basically that. Then for the core medical complications, they are also prone to hypertension, type 2 diabetes mellitus, ischemic heart disease, and stroke. The obese people, they are more prone to that. That's why I would encourage and advise them to reduce their weight, and also have do exercise, moderate intensity exercise, brisk walking. Then other complications, they can have hyperlipidemia, which is cholesterol can be elevated, the lipids in the blood can be high. Then they are also prone to other conditions, some cancer, at increased risk of cancers, gallstones, then heart failure as well, increased risk of heart failure. So all these are, they put the patient, the individual at increased risk of mortality. Because obesity is the myriad of conditions, medical conditions, that puts the individual at increased risk of morbidity and mortality. So that's why we are advocating that the masses, they know about all this and they take the right step. Of course, March 4th is the World Obesity Day, and the theme for this year is that everybody needs to act.
Everybody needs to act.
Yes, everybody needs to act, because it's not just one person. You understand? Family, society, they have to come and talk about this. This is not the time to be quiet about this. The time to act, diet, exercise, and other ways in which we can help these individuals live a healthier life. We should do that.
Okay, I think we should have talked about this where we're talking about the prevalence and or causes. There are some particular age groups that are more prone to being obese than the other. What age group is that?
Okay, so generally, it can be, as I said earlier, it can be for children. They can be prone to, there's no particular, I won't say there's a particular age group, you understand? Because I said earlier that it's just an interplay between the environment and also genetics. If you have the tendency to grow big, you will grow big.
From childhood?
From childhood. So that's why we even talk about childhood obesity, and we ensure that we talk more about ways to cut down on these junk foods, and encourage our children to eat healthy. Because once you notice that a child is gaining weight, you understand, you as a parent, you should start acting. You can register the child in a gym if he's up to an age to, then even brisk walking. Yes.
The exercises at home, like skipping and all that,
swimming, those things, they help to also reduce weight. Then your diet too. You should cut down on calorie intake, not taking ice creams and those high fat and carbohydrates diets that are rich in high in calories.
It's just for today, and then after 2 days you just go for it, and then
so because it's very important that we take note of this, because you see that there's usually, for obese people, there's usually an imbalance, because once there's an imbalance between the expenditure of the energy and also the intake, when it's favoring towards the intake of these calories, see that there'll be a problem, because there's an imbalance of energy between calories consumed and the calories expended. So if you are always taking in and you are not exercising, of course, it's normal that you will add the weight. So, of course, we talk about that.
Okay, now, you also talked about, while talking about the complications, you talked about having accidents, falls. Is it that it's the weight that makes the person just falls, or the person walks and doesn't even see what's in front of him and then he falls or something?
No, the weight, of course. When you're taking a lot, if you're a big person, you understand, even walking, mobility can be a challenge. For those that are obese and morbidly obese, some they will need to use cranes to take them from. They can't really do much for themselves because of the weight. Because of course their joints will be weak. Because all the weight on the knee joints.
To carry the body.
Yes. So these ones, they are prone to falls. They are prone to accidents. So it's a complication, and it can be a challenge really for some.
Okay. Now let's look at the preventive measures you can take to avoid obesity.
Okay, so the preventive measures is, of course, they say prevention is more important in medicine. Of course, the primary prevention is, of course, as we are doing now, we are doing health advocacy, sensitization. Of course, the government has a lot to play also in terms of increasing allocation for health. You understand? Because if the hospitals are equipped to detect, and they are specialists and they are doctors to detect this, they can nick it in the bud. You understand? They can stop the process. So we need that sensitization, and of course, we also need that the parents, especially for children that are growing up, that they know and they seek help, medical help in time. Because we as doctors would offer our patients and our clients, of course, important information that will help them lead a better lifestyle. So
a healthy lifestyle.
Yes, a better and a healthy lifestyle. You understand? So, for example, for adults, if they were drinking, alcohol is also one of it can also make you add weight too. So we'll encourage them to cut down on their alcohol intake, to quit smoking. Then also the diet is very important, to ensure that they eat a well-balanced diet that is devoid of saturated and trans fats. Because there's a particular type of oil that you should use, you understand, rich in polyunsaturated oil, then nuts, like a Mediterranean type of diet, you understand. There should be more vegetables. Then, of course, the caloric intake too, not much of the carbohydrates and fats. So we'll cut down on that. Then, of course, the exercise is very important as a way of preventing, because as you are taking in, you have to expend this energy. You have to exercise. So we'll say moderate intensity exercise, brisk walking, skipping, cycling, then swimming. These are things that you can do. You understand? At least we encourage at least 3 times in a week. You can do that if you have a very busy schedule, but you can at least exercise. You must not even go to the gym. You must not go to the gym. You can do it within at home, within your compound, and you exercise. So it's very important we talk about that. So, of course, we need to do more in terms of health advocacy for this, in terms of prevention.
Okay. So thank you so much, Dr. Emwanta. Now let's look at managing obesity or managing patients who are obese.
Okay, so of course,
from the medical perspective and from the non-medical perspective.
Okay, so of course, in my previous talks, I've mentioned some parts in the management. Okay. So you know that obesity is something that, of course, the diet is key in the management. The particular, we talked about the carbohydrate intake, and we should cut down on alcohol. Then for the carbohydrates, it usually should be of complex carbohydrates, more of vegetables, fruits, rather than simple sugars in the diet. Then also a total for a healthy a diet that would promote weight loss, you need a total about 1,000 kilocalories per day, which is made up of about more than 50 grams of protein, approximately 100 grams of carbohydrates, and 40 grams of fat. So it should not be more than that. That would promote weight loss. Then exercise too is very important, moderate intensity exercise. Then also behavioral modification to also encourage individual take responsibility for their changing lifestyle. So their dietary habits, their physical activity, which all these will help reduce obesity. Then there are some certain drugs also that we can also give to our patients when it's becoming a serious challenge. There's a particular drug which also can be given to some selected group. Of course, you would have to consult with your doctor for that prescription. Then the surgery can also be done in select patients, especially those that are morbidly obese. Yes, bariatric surgery and can also be done. And other surgeries can also be done for such patients. So basically, these are the management.
Okay. Thank you, Dr. Emwanta. Now, before we let you go, we would like you to please advise the audience against obesity.
Okay, thank you very much. So, as I said, as I've been saying, obesity is a global public health challenge. And of course, it occurs as a result of an imbalance in the energy between the calories we take in and what we expend. So you see that in the management, diet is very key. Then also exercise is very important. And of course, we will need to consult with our health practitioners, medical doctors, who will devise or tailor a management plan for you in terms of weight loss. Okay. So, of course, there are many people who have been taking drugs. They've been because, of course, that is a very key to lose weight, and really they are not losing weight. It's not working. So it's important that you seek medical advice.
Well, even if you must take drugs, there should be a lifestyle that should be changed.
Yeah, that should be changed. So it's a two-way thing. It's not just you taking the drugs. Of course, your lifestyle, there should be some modification to that. And you see that it's an important topic today because of the risk that it poses. It poses risk of hypertension, type 2 DM, which, of course, is ravaging nations. Many younger people are coming down with hypertension, with diabetes, because of our changing lifestyle. People are not tending towards the Western diets, so you see they're adding more weight. So, of course, it's very important that we draw attention to this topic. Thank you.
All right, thank you so much, Dr. Paul Emwanta. Listeners, we've been talking to Dr. Paul Emwanta from the Department of Medicine, Ahmadu Bello University Teaching Hospital, Sheikh Zaria, who is also a member of Association of Resident Doctors. He's talked so much about obesity, like the prevalence, the causes, and the signs of one who is obese. Well, thank you so much for coming on to this program, Doctor.
Thank you very much, ma'am.
Listeners, it's been Community Health. Join us same time, same station next week for yet another interesting episode of the program Community Health. I remain your host, Hasia Ali, saying goodbye.